So YouTube put my other channel, they took one of my videos down because of my content. They deemed it as medical misinformation because, you know, they're the medical information experts. YouTube's gonna destroy itself. It already has. So I tried to appeal it like I did the last one, and I won the last one, surprisingly, just because they usually don't grant any appeal, but they immediately said, no, it's, you're putting out medical information, which means it was true. It's just that they can't have the truth. If they weren't scared of the truth, they wouldn't have to take it down. And besides that, it's long before YouTube or any of the people that work at YouTube were on this planet, we had constitutional rights in place and still do. So they're violating them and don't care. But that will be because of that will create their own demise. But what I wanted to talk about in this video is electric shock therapy. The more I really study the landscape of the healthcare system, and mainly in mental health, because that's my area of expertise. I've said before, it's looking for hope. People are looking for hope in a pill. It's creating more victims. We have more mental health crisis. So as long as we have more problems, then we are going to have more we're going to have more of a need for a healthcare system. And it makes you wonder, if you go back far enough to the very top of this chain, the elites, the peer-reviewed experts that come out with everything, that we just automatically assume because it's a scholarly journal or it's peer-reviewed, that it must be right, and so we take it as fact, really have just been tweaking and not doing a whole lot, especially in mental health. So, the history of shock therapy in psychiatry. They used different types. They used insulin shock therapy, chemical convulsions in schizophrenia, electric shock therapy. Now, most people think that electric shock therapy is gone. It is not. But this is how well they propagandize to you, because when you were young, you were taught that not to stick things in a light socket, not to put your finger in the light socket, because it generates an electrical current and it could hurt you, maybe even kill you. But then when it's the medicine that's saying that this is safe and they put the word therapy after it, electric shock therapy is then therapy. It's no longer something that's possibly not a good idea to do. So basically, they still do electric shock therapy, and most people do not know that. They have a strict criteria for it. I have read books where patients have said that it did wonders for them. I don't have any direct evidence other than that. The criteria they have to follow is that every med has to have been tried, every alternative, before offering the treatment of ECT, electric convulsive therapy. Now, electric pulses like that you would do on muscles and that kind of stuff, that's different. But this is a treatment where they put the person under a mild anesthesia, and then they create a electric impulse in the brain that will lead to a seizure. And the theory behind this is that it will help the chemicals in the brain, and they basically, here, I'll read this. This is how they came to this. The early decades of the 20th century, or no, I'm sorry, that's not the part I want. Well, yeah, the early decades of the 20th century witnessed a major revolution in understanding and treatment of mental diseases. Up until then, people were just locked away in insane asylums. But that's where a lot of these things they did took place also, these barbaric treatments. So the knowledge that head trauma and convulsions and high fever could be good for improving mental disturbances is not new in medicine. Hippocrates was the first to note that malaria-induced convulsions in insane patients was able to cure them. In the Middle Ages, some physicians observed the same phenomenon. After a severe bout of fever, such as cholera epidemics in insane asylums, in 1786, a physician named Royce claimed improvement in mental patients after inoculation with smallpox vaccine. Furthermore, many physicians along the centuries have noted that there are very few epileptics who are schizophrenic, and a biological theory, the incompatibility of convulsions and mental disease, slowly evolved. In addition, for centuries, physicians have been fascinated with the idea of treating mental and neurological diseases by using electricity. And so there were two schools of thought. It's the advent of treatment of psychosis by using physiological shock increased the opposition between two schools of thought within psychiatry, the psychological and the biological. The psychological school interpreted mental disease as being due to deviations in the personality, problems in rearing and childhood, discontrol of internal drives, etc., caused by external factors. This school was typified by psychoanalysts founded by Sigmund Freud in the beginning of the 20th century. The biological school instead considered that mental diseases, particularly the psychosis, were caused by pathological alterations of the brain, chemical, or structure. So really what they did was they were just shooting in the dark with many of these things. I mean, it was really just experimenting. And you have to wonder, again, what came first? You know, you hear all the time, the chicken or the egg. Well, in this case, which came first? All the viruses or shots, or because the mental health crisis is out of control and we still do the electric shock therapy. And most people don't know that. We don't do lobotomies anymore. Lobotomies were gotten away with, and for obvious reasons. But if we're still doing electric shock therapy, that should tell people that's how far mental health has come. Like, that's how little they've done research. Yes, they put out these papers, and then your psychiatrist and your mental health professionals read them and think, oh, scholarly people wrote them, so they must be true. But on the face of it, think about it. You're putting electrical currents into the brain. That doesn't sound like such a good idea. It just doesn't. I have never seen any. I know it's done. I've seen it done. I've not taken part in it. But years ago, I saw it done when I worked in a recovery room. They would bring patients from the psych floor, and they would do them because they needed to use the monitors. And they would do the mild anesthesia, and it puts the person in a seizure. They don't know it because they're under anesthetic. But and the whole theory is that it will relieve suffering. Lobotomies, on the other hand, a lobotomy is a surgical procedure which involves removing or damaging, not removing a damaging part, but removing or damaging parts of the frontal cortex. Lobotomies were historically used to treat patients with psychological illness and behavioral disorders. This was during the 1950s, so it wasn't that long ago. They were largely phased out and replaced with medications and talk therapy and other forms of treatment. As a general rule, lobotomies are not performed today, and many people think they are actually quite barbaric. Yes, they are. They can leave people in a vegetable state. When performed successfully, a lobotomy could result in significant behavioral changes for patients. For psychotic patients, lobotomies were sometimes beneficial, calming the patient so that he or she live a relatively normal life. Lobotomies are also famous for causing a flat affect and general decrease in responsiveness. This is because they're basically in a vegetative state. A flat affect, we use that term in psych, That's you don't want to see a flat affect. It's like nothing there. It's just like many depressed patients, you know how depressed they are because they'll have a flat affect. This was viewed, okay, so lobotomies are also famous for causing a flat affect and general decreased responsiveness. This was viewed as a benefit of the lobotomy historically by some advocates of the procedure. However, lobotomies can also go very wrong. The brain is an extremely delicate and very complex organ. And in the era when lobotomies were performed, people did not know much about the brain. So right there on the surface should tell you, if you don't know much about the brain, then maybe you shouldn't just be going in, opening it up, or putting electrical impulses in it. This is how the science has been. So let's see, where did I leave off? When lobotomies were performed, people did not know much about the brain, as they did not have the benefit of a wide range of scientific tools to visualize the brain and its activities. At its worst, a lobotomy could cause death, but it could also cause serious brain damage, resulting in what was essentially retardation of the patient. Patients could also enter comas and have persistent vegetative states after lobotomy. The earliest lobotomies appear to have been performed in 1892. The man was out of Switzerland, this doctor that did him. 2 of his patients died, so the procedure could hardly be called a screaming success, but it planted the seeds for a Portuguese doctor who worked on a version of the lobotomy in the 1930s, which involved cutting holes in the patient's skull and injecting in the frontal cortex alcohol to kill parts of the brain. Yes, kill parts of the brain. This doctor was given a Nobel Prize in 1949 for that work. Then it came to the U.S. That was around the 1950s to treat psychiatric disorders. I guess they are still performed today. That's rather sad. But the point here overall is that we have not moved the needle in mental health. We've only made it worse. And I believe that's deliberately done because it disempowers people. The fact of the matter is, if you're depressed, if you have anxiety, even bipolar, as much as the science wants to say they listen to all these peer-reviewed articles and it's a chemical imbalance, there are ways of addressing those chemical imbalances if that in fact is true. And who knows, because it's the very top of that chain that has been always controlling the peer-reviewed articles. So, we really don't know the truth. Like, there should be an answer or cures for like schizophrenia. We still have not moved the needle on knowing any of this stuff. So every time they tell you the science is experts, ask yourself, what have they done that's expert, that would deem them as experts, other than the media telling you 200 times a day that they are. In mental health, they have done nothing to improve things. They haven't. The very fact that they're still doing electric shock therapy, think about it, electric shock therapy. And electric shock, but they put therapy on the end of it. So it's like, oh, well, then it's okay. When medicine says it's a therapy, then it's safe, because we've just been taught that the experts and the scientists, we have to listen to them because they, of course, would have good intentions. But they didn't back in many decades ago. With mental health, they were very cruel to mental health patients. And it makes you wonder, did they create certain viruses? And because they used the smallpox as a way to, as I just read, did they create viruses and those caused mental illnesses? There's so many unknown questions here that should be asked, really. I mean, this didn't dawn on me until last night, because I see how there's certain nurses, they've worked at places where they do ECT is electric shock therapy. And You know, they've been pulled in by the propaganda. I have been, everybody has, because of the very fact that you're told these are the scientists, this is who you trust. And yet they don't create any successful outcomes. I mean, that's a big deal. I was always taught as a nurse is that, you know, it has to prove to have successful outcomes. Do you know my own scientific things I've done, and I don't mean with medicine, but just things I've tried to improve like simple things, such as when I worked in DC with DCFS kids, making sure that a kid that was on my unit, because many times they would be with us for months, that their birthday didn't go ignored, because the state would just ignore it. So I would get them a cake. This was all ways to help nurture and improve behavior. These are children, when you see children lashing out and hitting, especially if they're in DCFS, it's because nobody's ever taught them any other coping skills. It's just like an animal that's cornered. It's going to attack. That's all they've been given, because many of these children have gone from trauma to trauma. I came up with some very great ideas of how to be successful with many of these kids. They're resilient kids. They need that nurturing. And the very state, I think most of the states in the United States too, that because the state is their guardian, fails them miserably. And I wouldn't be surprised if they do it on purpose. They keep it untherapeutic. It's cruel. It needs to stop. And it should be obvious that there's something very wrong with all the science and mental health, because they just look for pills to fix everything instead of really getting to the root of successfully solving the problem. And as long as we're going to have medicine that's only going to create problems, we're going to have foolish people like Tony Fauci and the head of the Communist Disease Control Center telling us that they know best and this is what we should do, when all the while they still have us in this well, they're still carrying on about the crisis we're in. Most people have moved on with their lives and they're done listening to them. But the fact of the matter is, these people are not experts. They don't come up with successful outcomes. We should have been long past having to do electric shock therapy anymore. And antipsychotics are poisonous to the body. They are, just like chemotherapy is. This is what the experts that we've been told all our lives that we are supposed to listen to, these are the things they've come up with. So that should tell you they are not experts, and they likely never even had a science class.